Chairman. You know, one year into this Congress, we have delivered meaningful wins that keep more money in the pockets of hardworking Americans. We increased the standard deduction, expand the child tax credit for working families, and provided real relief at a time when families need it the most. In the Working Families Tax Cuts, we also strengthened the Medicaid program to serve those who rely on it. Mr. Roy, how do the changes made in the Working Families Tax Cut Act strengthen Medicaid and improve the program's effectiveness?
I think it's really important to increase the program integrity, and that's one of the things that the Working Families Tax Bill does, right? So you're going to have more people who are actually eligible for Medicaid enrolling in Medicaid, and the ineligibility will go down. Also, I think one of the most important things in that bill that is really was very politically hard to do, and I give Congress enormous credit, was to start tackling the as what's been described as the shell game of state-based provider and premium tax credits, which are a technically legal but spiritually fraudulent way for states to draw down excess federal dollars that inflate the cost of Medicaid. As I mentioned earlier in response to a different question, the cost of subsidizing Americans in the ACA Medicaid expansion is actually higher by several $1,000s per month or per year than subsidizing people in the ACA exchanges. When the Affordable Care Act was passed in 2010, the CBO made the opposite projection, that it would cost $9,000 per year to subsidize people in the ACA exchanges and $6,000 per year in Medicaid. The actual ratio has been flipped because of those state provider and premium taxes that states have used to inflate Medicaid costs. So I think that was incredibly important. I really am impressed that Congress was able to make some headway on that topic.
You know, I've noticed that Democrats keep using these preposterous adjectives to describe a bill that went after reducing waste, fraud, and abuse across various programs. This was about common sense reforms to stop programs from paying millions of dollars and often to dead people. Just curious, the Trump administration and Republicans, as we referenced earlier, have taken important steps to bring greater accountability to government spending. It also includes major fraud schemes like those in Minnesota where, frankly, oversight failed. Dr. Ippolito, what changes are needed to clear the vulnerabilities that currently exist in our Medicaid and our Medicare programs?
That's a big question, but I guess I would say on the Medicaid side of the ledger, I think it all starts with incentives. As long as the federal government is paying for some populations 90%, including financing schemes, more than 90% of the cost, it's going to be very, very hard to discourage at least fraud-adjacent behavior. In the Medicare program, I think there's a number of opportunities. Traditional Medicare needs to do a better job of policing itself. There's no other way to do it. Medicare Advantage, I think the biggest challenge there is simply making sure that when you send checks to those insurance companies, you send them a reasonable amount, and you don't give them an incentive to play games with coding behavior and the like.
You know, over the past decade, we've seen the so-called Affordable Care Act be anything but affordable. Instead, premiums have skyrocketed and families have been left with fewer choices. Mr. White, more than 1/3 of enrollees in the Obamacare exchange had zero medical claims. I believe you touched on this earlier, how that compared with the private insurance market. And then roughly now, healthcare spending accounts for roughly 20% of our nation's GDP and approximately 1/3 of the total federal spending. But despite spending more per capita on healthcare than any peer nation, the United States continues to experience comparatively poor health outcomes and lower life expectancy. I mean, what are the policy objectives we should be looking at? Because it's clear that just throwing more money at Obamacare is not working. What do we need to do? And I'll open up to either three of you on that.
Yeah, I think the status quo is broken, right? Like the situation you're in, you're locked into this crazy Obamacare structure where we made the plans much more expensive, and then we gave you a subsidy to afford those more expensive plans, but said you could only use the subsidy there. We need to allow people to have agency, which means they have freedom to go out and choose a plan that best works for them, a lower cost plan. In Virginia, I live in Virginia, there are plans in every market in Virginia that are less expensive than Obamacare, but no one can use their subsidy on those plans because the law says those aren't good enough.
It sounds to me like the answer ultimately is more free market. That helps the market. That helps folks like Rena here and everybody else. With that, I believe my time's expired. I yield back, Mr. Chairman. Thank you.